us. Now, there are many hospitals across the country who are facing the brunt of low oxygen supply. Many hospitals, as you must have seen over the last week, saying that we have only half an hour of oxygen left, barely scraping through, managing somehow, and then the truck pulls in. What if the truck gets a flat tire or there is a blockade? Imagine how much we are risking as of this moment. And there are many doctors in many hospitals that have started speaking about this. I have with me Dr. Devlina Chakravarty, Managing Director of Artemis Hospitals in Gurugram. Thank you very much, Dr. Chakravarty. Yours is one hospital which is facing this crisis. I remember in an earlier broadcast you said that you only have oxygen for a couple of more hours. I want to know from you, eventually somehow hospitals are managing. But yes, in the immediate as well as the long term, what do you propose? See, there is an oxygen crisis. There is one. It's not hidden from anyone anymore.
Absolutely. So, yes, of course. And the crisis is real. And it is unnerving for us to face a crisis like this. And like Dr. Guleria and Dr. Trehan had mentioned, nobody had anticipated it because the virus is more virulent and spreads and whatever the reasons. So it's not like blaming anybody, but the problem is real. So yes, hospitals like ours, and my tweet in the morning said that we had 3 hours. In the interim, with the help of local administration, we got some cylinders because we have liquid oxygen, which is through a central supply. We got cylinders filled in, we put it in parallel with our central oxygen supply to somehow hold and sustain. And as we speak, I have got 1 ton from the administration, which is going to see us through till 1 a.m. And by then, we are hoping the next truck with another 2 tons to come from our regular supplier, which would probably see us for the next half a day. So it's a day-to-day living for us. So the solution is basically, like I have tweeted, it's one nation and one problem. Let us understand the demand has gone up, no doubt. But let us understand who all can supply. So a lot of corporates, a lot of steel manufacturers, people dealing with metallurgy, welding metals have come forward because they have oxygen available, but they do not have the oxygen tankers to get it to the hospital. So we need to fix our surface logistics like never before. And who can do it better? I don't know. Maybe the army, who manages supplies across the country in no time. So let us fix
No, but the army has been roped in, Dr. Chakravarty, even as we speak.
Yes,
they're using their...
And I'm just reiterating the fact that yes, like it's a war room, so we have to have, and I am grateful that what has happened. And we have to understand. And second is, we have to optimize the use of oxygen, which every hospital is doing today.
Correct.
We are maintaining the SpO2 level at 88, 89, 90 instead of 93, 94.
Correct.
We are, instead of high flow nasal cannulas, which waste a lot of oxygen, we are using, we are either ventilating the patient or we are putting the mask with a reservoir, so on and so forth. Yeah. And third is, we have to have a very consultative management style. Hospitals should get together, and rather than having, it's for me, we should try and share if you can help each other.
Yeah, I think that's a really valid point, because in Delhi we did observe that there was a situation where hospitals had started accusing one another of taking the cryogenic truck away, which is not a very pleasant situation.
Which is unfortunate.
Let me come back to you. Dr. Sagar is also with us. He's the CEO of Shanti Mukund Hospital. Dr. Sagar, good evening. I want to ask you, first of all, if you can narrate the trouble that you are facing. I mean, we reported extensively from your hospital. And also, I would ask you or urge you, how do you think or how do you suggest that this can be fixed in the immediate as well as in the future?
You see, the problem is a shortage in the supply of the oxygen, which has certainly gone up. I will try to explain. In a normal case, in a normal working of the hospital, 30% of the patient, they require oxygen, including in the ICU. And the volume of the oxygen which is supplied to them, to the patient, varies from 2 liters to about 6-8 liters. But in this situation, when COVID is there, 90-95% patients, they come to the hospital, they are COVID patients. and the volume of oxygen which is required to be given varies from 6 liters to 30 liters anywhere. So therefore, the demand has gone up by 10 times. We were not prepared, the government is not prepared, or the oxygen manufacturer were not prepared to supply that sort of oxygen, and that's why we are running short of this. The optimum utilization of the oxygen, basically we have to understand that what type of oxygen, what volume of oxygen should be given. We will to some extent